That would lead us to conclude, I think, logically speaking, that the Wuhan coronavirus was with us well before February of 2020, well before January of 2020, especially when you consider the lockdown, right? We've locked down our society, ostensibly protecting everybody from exposure, screwing up herd immunity. That's another story. But the bottom line is, it seems as though the antibody testing is revealing somewhere in the order of about a quarter of the population. Do you think that's an accurate number?
I think that's a brilliant point you're bringing up, and somehow you must have listened to me. I've been bringing that point up for the past few months, and I truly believe that this virus has been around probably since September or October of last year. Mm-hmm. Credit is due for President Trump for putting this travel ban and blocking a lot of this virus coming to our country. But you're right, a lot of people already have been exposed to this, and maybe they had no symptoms. Maybe they recovered. Maybe they have had 48 hours of flu symptoms, and that was their coronavirus exposure. But we think that even though the numbers are talking about 1.7 to 1.8 million diagnoses with coronavirus, it's probably in the range of somewhere around 20 to 30 million out there. It's hard to know because our testing haven't ramped up. We so far have tested about 50 million people. And the CDC is ramping up the number of testing. But I agree with you. I think a lot more people have been exposed that either have recovered or they just had very minor symptoms and they're perfectly good to go.
And these governors, I think you would agree, Doctor, are screwing up the herd immunity that we need to have transpire, especially in schools, especially among the young people. We know the data is showing us that if you're between the age of 0 and 20 years old, it's effectively zero, the chances of you dying from the Wuhan coronavirus. And that leads me to hydroxychloroquine. Do you have any doubt in your mind the benefits, and would you have any hesitation at all as a physician in prescribing hydroxychloroquine along with whatever drug cocktail you would recommend, whether it's a Z-Pak or what have you? There have been various versions of the use of hydroxychloroquine. Would you hesitate at all, either taking it or prescribing it?
Well, let me first make a comment about your first part of the question, and that's it. The fact that we can look at many other countries where they kept their schools open and they closed their nursing home, and that was the best approach to this virus, which is exactly the opposite of what we're doing in a lot of these hotspots. What we've done is we've kept our nursing home open and closed the school, and this doesn't make any sense. Right. And a lot of the death is coming from this category of people. When it comes to hydroxychloroquine, I don't know why this medication has become so politicized, because I don't think it's really personal. The plan that President Trump is putting forward is to save as many Americans as possible. It's a pandemic, and we all need to get together and defeat this virus. Now, hydroxychloroquine, when it's given at the early stage of this disease, can reduce a lot of these inflammatory cells, that's cytokine storms that will take over your lungs and your heart and your other kidneys, etc. So it is pretty effective with zinc and Z-Pak. There are many other medications like remdesivir. Now we're talking about ivermectin, which is antiparasitic medications. So all of these are coming in. But if you see people who have taken this early on, the result is excellent. By the time they get into the late stage of the disease or close to ventilation, hydroxychloroquine may or may not work. And that's the bottom line. And that's why I was so surprised, Graham, when Lancet published this below average study, completely full of bias, and botched this whole thing against hydroxychloroquine. And on top of it, World Health Organization, that's supposed to fight for the world, for Americans. And they stopped all of their clinical trial based on this observational study from Lancet, which was very embarrassing to see that published. So it's all becoming more political, unfortunately, and not too much science and medicine.
And a lot of these are not really studies, Doctor, and you know this. They gave hydroxychloroquine as a last resort to some dying patients who probably had comorbidities, who would have died even without the Wuhan coronavirus, and they raise their hands and then they say, oh, the hydrochloroquine didn't work. End of story. I think it is terribly political, and unfortunately it's political because the President of the United States, who so many people in the mainstream media despise, happened to say, hey, this is a drug that has promise, and he even took it himself. So immediately it becomes radioactive to a certain sector of our society, and that is a shame. Doctor, thank you.
Want to see more videos like this? Click on the link below and subscribe to One America News on YouTube, and call your cable provider and kindly demand that One America News is added to your lineup. Call and subscribe today.